Today, we'll take a look at climate change and sustainability in the field of dermatology. So, first, why is this important? Well, we know that climate change impacts human health, but here are some specific ways it impacts our skin, from the exacerbation of existing skin conditions to the development of burns, infectious diseases, and skin cancer. It's important for the dermatology community to take a stance against climate change. But first, let's look at the ways that dermatology and other areas of healthcare contribute to climate change, as most of these are not specific to the field of dermatology itself. This includes greenhouse gas emissions from commute for both patients, employees, and then also deliveries, single-use materials like gloves, alcohol swabs, Q-tip applicators, the pharmaceutical packaging of medications, waste from procedures, and the disposal of regulated medical waste or contaminated waste and sharps, as this medical equipment requires the use of steam autoclaving, thus increasing its environmental impact. One specific area of interest we can take a closer look at is the waste produced by the use of biologic medications. Now, there are many areas to target in the production and delivery of biologic medications, including the packaging, their transportation, production costs, and the waste of the actual plastic injectors themselves. In this image, you see here a standard packaging of a single month supply of a biologic medication, including a cardboard box, a cooler, an ice pack, bubble wrap, paper instructions, and then finally the pharmaceutical packaging of the medication itself with the plastic disposable injector inside of it. So let's talk about some of the areas of improvement. Specific to the biologics problem, there are some solutions that have already been proposed or are starting to be implemented, including the repurposing of the plastic from the pre-filled injector devices. Potentially, we could have a recycling program where we're able to safely dispose of the internal needle and then reuse the plastic. We can eliminate the cooler packaging and use a more recyclable product. We can transition to using reusable, recyclable packaging models where patients may be able to reuse their own carrying device or be able to send it back to production, transitioning to electric vehicles for delivery and transportation, potentially implementing a centralized pickup location at pharmacies that keep the medications in the standard temperature range. And this would also allow access to help communities that don't have access to refrigeration. And then one of the biggest areas of improvement is increasing the number of doses sent to patients per shipment, as right now they only see 1 month supply at a time. We could drastically cut down on emissions associated with shipping and delivery if we're able to send patients 2, 3, or more month supply at a time. Other areas where dermatology can improve come down to specific practice choices, including how often you're using disposable versus sterile gloves for patients that might not require them, the use of specialized Mohs surgical sets, and reuse in each stage of surgery rather than opening unused equipment. The implementation of telemedicine when appropriate to cut down on carbon emissions from travel, and the use of disposable sutures rather than ones that require removal to prevent the further use of a disposable instrument set that's given to the patient or travel for the patient to come back to get them removed. Many of these concepts and more have already been proposed in the field of dermatology, but including the implementation of audits to identify areas of improvement can help to educate staff about waste management. Now, the field of dermatology is bright, and with the implementation of sustainable actions that decrease the contribution to climate change, we're leading dermatology to practicing higher value care with better outcomes for both patients and clinicians.